How does TPA thrombolytic therapy work for stroke? Imagine a sudden blockage in a blood vessel in the brain causing a stroke. TPA, or tissue plasminogen activator, is a medicine that can help clear that blockage. It works by dissolving blood clots that block blood flow to parts of the brain during an ischemic stroke. This process is called fibrinolysis, which means breaking down fibrin, the main protein in blood clots. TPA activates an enzyme called plasmin, which then breaks down fibrin and dissolves the clot. This helps reopen the blocked artery, allowing blood to flow again to the brain tissue that is at risk but not yet permanently damaged. Restoring blood flow quickly is crucial because the longer the brain is deprived of oxygen, the more damage occurs. TPA is given through a vein, usually in a hospital setting. The best results happen when it is administered as soon as possible, ideally within 4.5 hours of noticing stroke symptoms. The typical dose is 0.9 milligrams per kilogram of body weight, up to a maximum of 90 milligrams. About 10% of the dose is given as a quick injection over 1 minute, and the rest is infused slowly over the next hour. The sooner TPA is given, the better the chances of improving recovery and reducing disability. However, the timing is critical because the benefits decrease as time passes. Clinical studies, including the well-known NINS trial, have shown that patients treated with TPA often have better neurological recovery and improved function 3 months after a stroke. While there is a risk of bleeding in the brain, known as symptomatic intracranial hemorrhage, the overall benefits in reducing severe disability or death tend to outweigh this risk in carefully selected patients. That's why doctors follow strict guidelines to decide who is a good candidate for TPA. They look for factors like recent head injury, bleeding risks, or certain medical conditions that might make treatment unsafe. It's important to remember that TPA is only approved for strokes caused by blood clots blocking blood flow, not for strokes caused by bleeding in the brain. Sometimes, mechanical procedures called thrombectomy are used alongside or after TPA to remove large clots from big arteries. During treatment, patients are closely monitored to manage blood pressure and watch for any complications. Because every patient is different, treatment decisions are personalized and made by stroke specialists in a hospital setting. In summary, TPA works by enzymatically dissolving blood clots to restore blood flow in the brain, which can limit brain damage and improve recovery if given promptly and correctly. Always consult healthcare professionals for personalized advice and treatment options.